Hello everyone, it's Kevin Jackson. I'm here with Cruz, AT&T Business Healthcare Solutions General Manager. How are things going with you today?
Really good, Kevin. Thanks for having me.
I tell you, it's been about a year since we talked, and the last time, FirstNet was really big. How was that going along?
It's going great. It continues to be one of the major areas of focus from AT&T. As you know, the First Responders Network is a dedicated network for the first responders, 24/7, 365. Healthcare is a major player in the ecosystem, along with law enforcement and the fire departments. It really does provide the prioritization preemption capabilities that we need, so in the time of crisis or severe weather, AT&T can be there for the first responders. So super excited about the work we're doing from a first responders perspective.
Where AT&T was also in front of the use of 5G, especially in healthcare. You guys are doing a lot of work with Rush Medical Systems. Where is that right now?
It's going well. So yes, the 5G, the fifth generation wireless network. A lot of hype, a lot of expectations around the network capability from a bandwidth, latency and jitter perspective, and what kind of immersive experiences it can deliver. So to your point, we announced earlier January this year our relationship with Rush to be able to start exploring and building the 5G roadmap. Also VITAS Healthcare the following month in February as we focus on the hospice end-of-life experience. We're conducting some research with VITAS right now that really substantiates and validates some already published research around this area, where by providing a video content, cognitive behavior therapy type of solution, it really separates the mind from the body and really provides relief to those patients, either chronic pain management or end of life. So rather than putting them on medications that could be addictive in nature, providing that different solution is a game changer in those spaces. So super excited about the work we're doing with VITAS. Finally, I'll share that we're focusing on exploring and continuing to build the roadmap from a 5G perspective as it relates to education and training, as it relates to 3D virtualization and collaboration in healthcare.
Yeah, a lot of hype around 5G. As a user of smartphones, what is this going to do with respect to me as a consumer of healthcare?
Continue to see a lot of activity as you focus on the rise of consumerism into healthcare, and you're seeing how the providers are starting to shift their thinking. Not only do they focus on them as the patient, but what is the patient/consumer experience? A lot of different, a lot of thought going on around how do I check in? What's my check-in experience? How do I navigate and use wayfinding to navigate myself through the hospital? Finally, what are some of the solutions out there that we help track patients to map those journeys, understand how they cross paths with different aspects of the provider. So very cool stuff going on from a consumer perspective, and really focusing on delivering the best experience possible.
Healthcare is a highly regulated industry. How about government? Are they going to do anything to sort of drive this change?
Well, we're definitely expecting big shifts as we roll into January 2020, where the regulatory framework is changing its reimbursement model. So in the past, remote patient monitoring and telehealth was only reimbursed for chronic pain management as well as rural health customers. Today, or in January rather, you're expected to see that model change to include everybody in the healthcare ecosystem. So you're really starting to see the four walls of the provider space crumbling down and seeing the care be expanded outside. So it becomes paramount to stay connected to the patient, to be able to collect the symptoms and the data, and being able to provide it, bring it to the provider space to not only monitor what's going on with the patient, but even become proactive in the diagnosis of different conditions. So a lot of work going to happen there, and same falls in line with telehealth. So telemedicine and the ability to provide those remote consultations will also be reimbursed. So Kevin, a lot of activity around those two areas as we flip the calendar to January next year.
I tell you, there's some very important trends across the entire industry. So as a learned observer and active participant, what's happening in this industry in the near future?
I really think the areas we covered today, right? I think it'll be a lot of focus on FirstNet, 5G, the consumer patient experience, as well as paying close attention to that regulatory shift from a remote patient monitoring and telehealth. All that will keep us very busy in 2020.
Okay, well, I'm going to keep a tab on you as these things change. So
Look forward
thank
to
you
it,
very
Kevin.
much
Thank
for
you.
spending time with me today.
My pleasure.
All right.